Hello, lovely people. Welcome back to the channel. If you're new here, my name is Your Name, and I'm your go-to for all things health, wellness, and keeping up with important news that matters to you. Now, today, I've got some super important news to share with you, especially if you're a senior living here in the UK. So, grab a cuppa, settle in, and listen up because we're diving into some big changes that are coming to the NHS in March 2025. And trust me, these changes might just affect the way you visit your GP, get your prescriptions, and even manage your health in general. The NHS has always been a cornerstone of healthcare in the UK, but as the country's population continues to age, especially with more people over the age of 65, the system has had to adapt to new challenges. So, these upcoming changes are meant to streamline services, address growing pressures, and improve overall patient experience. But the truth is, it's not just a matter of making things more convenient for the NHS, it's about improving the way seniors receive care, and making sure no one gets left behind in the process. Now, before we get started, if you're a senior, or you've got elderly parents or grandparents, this video is a must-watch. The new rule changes coming in March 2025 are making some serious waves across the NHS, and it's important that you understand how they'll impact your healthcare. So, grab a comfortable seat because we're about to break everything down for you in a way that's easy to understand, no jargon, just the facts. I know it can all sound a little overwhelming, but trust me, you'll walk away from this video feeling more confident and informed about what to expect from the NHS changes. So, what exactly is changing in March 2025? The NHS is introducing some significant updates to how GP services will be offered to the public. These rule changes aim to modernize the way that medical practices operate, especially in the way seniors interact with their doctors. You see, there's been a growing concern about how the NHS is managing the increasing demand for GP appointments. With a growing elderly population and an aging demographic, these changes are being introduced to ensure that services remain efficient, accessible, and fair. The introduction of these rule changes is, of course, a response to the significant strain that the NHS has been under in recent years. As more and more people seek GP appointments, the demand for services has far outpaced supply, and this has led to longer waiting times, difficulties in getting an appointment with your regular doctor, and frustration for many patients who feel like their care is getting lost in the shuffle. These new changes are designed to address those concerns head-on by making healthcare services more efficient and improving the overall patient experience, but especially for the older generation. For many seniors, routine appointments with a GP are crucial for managing long-term health issues, so it's vital that these changes help, not hinder, the process of getting the care you need when you need it. So, let's take a closer look at how these rule changes will directly impact you, especially if you're a senior or know someone who is. Let's break down the most significant change, how appointments and consultations will be handled going forward. With these new rule changes, the NHS is pushing for a more streamlined approach to booking and managing appointments, especially for those who need frequent checkups. The big change here is the introduction of a new digital-first system for non-urgent appointments. Now, don't panic just yet. This doesn't mean you'll have to go fully digital overnight, but it does mean that a lot of the process will be shifted to an online system. For those of you who are comfortable with technology, this is a great way to get faster, more convenient access to your GP. You'll be able to book appointments, receive health advice, and even order repeat prescriptions, all from the comfort of your home. This shift is also designed to reduce the strain on the NHS's call centres, freeing up resources for more urgent matters. The aim here is to make sure that patients can quickly access healthcare without clogging up the system with minor issues that can be easily handled digitally. But I know what you're thinking. What if I'm not great with technology? Will I be left behind? Great question. The good news is that the NHS has made provisions for those who aren't as tech-savvy. There will be help available at your local GP practice, and senior citizens will still be able to access phone consultations or in-person appointments if necessary. So, there's no need to worry if you're not used to navigating online portals, they've thought of everything. In fact, your local GP will help you sign up for the online system and guide you through the steps so that you feel comfortable using the new digital tools. Plus, if you prefer to handle things the traditional way, you'll still be able to call in and book an appointment through the phone, or walk into the office to book face-to-face. It's all about offering a choice that suits your comfort level. Let's talk about virtual GP services. Over the last few years, we've seen a huge rise in telehealth, where patients consult their doctors over the phone or through video calls. This trend isn't going anywhere, and in fact, it's about to be expanded under the new NHS guidelines. In March 2025, there's going to be a major shift toward remote consultations, especially for non-urgent cases. This means that if you're just needing a prescription refill, a quick checkup, or some advice on a minor ailment, you might not need to visit your GP in person at all. Virtual consultations can save you time, reduce travel stress, and allow you to have a conversation with your doctor from the comfort of your own home. Plus, for those of us who have mobility issues or live in rural areas, virtual consultations will make accessing healthcare much easier. However, this brings up some important points that seniors need to consider. While this is convenient for some, it could potentially leave others feeling disconnected, particularly those who aren't comfortable with technology or those who have complex medical needs that require in-person attention. So, what's the solution for this? Well, the new rules are being designed to strike a balance. If you're someone who prefers face-to-face consultations or if your health condition requires in-person attention, your GP is still obligated to accommodate you. Virtual consultations are meant to help streamline the process for simpler cases and free up time for more urgent appointments. But always remember, if you feel like you need to see your GP in person, you absolutely have the right to request that. The NHS recognizes that the personal touch is incredibly important when it comes to healthcare, especially for those with long-term health concerns or complicated medical histories. So, if you feel that virtual consultations aren't for you, don't hesitate to ask for an in-person appointment. Now, let's talk about something really important: how these changes affect seniors with chronic conditions or long-term illnesses. One of the biggest concerns seniors have when it comes to these new rules is how they'll manage their ongoing medical needs. We know that many elderly people live with conditions like arthritis, diabetes, heart disease, or dementia, and they require regular visits to their GP for checkups, medication reviews, and management of their conditions. It's important to understand that these new rule changes have been designed with seniors in mind. In fact, they're aiming to improve the quality of care for people who have chronic conditions by making sure that you get the attention and support you need without long wait times or frustrating delays. The NHS has introduced a system where seniors can have their care plans reviewed more frequently, ensuring that conditions like diabetes, heart disease, or dementia are actively managed. So, if you have a chronic condition, you'll still be able to receive the right level of care, even with the new digital systems in place. This new system is about being proactive, not reactive. GPS will be encouraged to check in with seniors who have chronic conditions on a regular basis, whether that's through virtual consultations, phone calls, or even in-person visits if necessary. The goal is to catch issues early before they become serious, and to help you manage your condition more effectively. So, for example, if you're managing diabetes, your GP might schedule an annual review without you having to ask, and you'll be able to have virtual consultations if you prefer. This proactive care plan could help prevent complications, and it may even reduce the frequency of hospital visits, which is a win-win for everyone involved. Let's move on to another critical area: repeat prescriptions and medication reviews. For many seniors, repeat prescriptions are an essential part of managing health. Whether it's for high blood pressure, pain management, or anything else, making sure you get your medication on time is a top priority. Under the new rules, there will be a more streamlined approach to managing prescriptions. Now, in some areas, you'll be able to order your repeat prescriptions digitally and have them sent straight to your local pharmacy for pickup. This means fewer trips to the doctor's office and a quicker process overall. It also means fewer people will need to come into the GP for minor requests, leaving more time for those who need urgent medical attention. The NHS has also introduced a system where your medications will be reviewed more frequently, especially for those on long-term prescriptions, to ensure that you're still on the best treatment plan. This will involve regular checks to make sure that your medications are working as they should, and if not, your GP might adjust them to better suit your needs. In addition, if you're managing a chronic condition, the NHS is going to implement more regular medication reviews to make sure you're on the best treatment plan possible. But don't expect things to stay the same. With these rule changes, it's likely that we'll see some GPS becoming more involved in the management of prescriptions, and in some cases, there may be additional reviews required to ensure you're not over-reliant on certain medications. So, if you've been on the same medications for years, be prepared for some questions or adjustments in your treatment plan. So, now that you know the basics, how can you prepare for these changes? First things first, get familiar with your GP practice's new appointment system. If they are moving to a digital-first model, make sure you're comfortable with booking your appointments online or through an app. If you're unsure about how to use these systems, don't be afraid to ask for help. Your GP practice will likely have staff available to assist with getting you set up on the online system, and they might even offer training sessions for those who are not familiar with how to use these digital tools. Another tip is to make sure your contact information is up to date with your GP practice. That way, they can reach out to you if you need an appointment or a medication review. If you don't have access to the internet, ask your practice about alternative ways to book appointments or get health advice. And finally, be proactive about your health. If you're unsure whether you'll be impacted by these changes, take a moment to talk to your GP about what's coming and how it might affect your care. They'll be able to provide you with more specific information about how the changes will affect you based on your medical history. So, there you have it, everything you need to know about the NHS new GP rule changes coming in March 2025. These changes are designed to make healthcare more accessible, but it's important to stay informed so you can make the most of them. If you found this video helpful, please give it a thumbs up, share it with your friends and family, and don't forget to subscribe for more updates like this one. And, as always, leave me a comment below if you have any questions, or if you want to share how these changes might affect you. I'm always here to help. Until next time, take care, stay healthy, and I'll see you in the next video.